every month, every girl, every female has to go through their periods, lasting from 3 days to 5 days, and for some, it can be around the 7 days also. Now, these periods and preceded a week or 2 weeks before these periods, you have a premenstrual symptoms, your premenstrual syndromes, where you are facing a lot of emotional, mental, and physical issues. These days are really, really devastating for some. For some, it is fine, they are easily good to go, and for some, it is okay, manageable. But for those, it's who for them it is really devastating. Do we do they really have to go through this every month? Is there something can we do for this thing? So today, in Tea Time and Gossip with me, Dr. Aparna, we are going to discuss each and everything about your PMS and how you can get relief from them. So let's start. Your PMS can include a lot of emotional, physical, and mental symptoms. These can range from bloating, that is the feeling of fullness in your abdomen region. Your abdomen can be swollen. Your breast tenderness. Now, breast can become swollen, sore, and very sensitive. Headaches. A lot of people complain a lot of headaches. Fatigue, feeling low energy throughout the day. किसी भी काम में मन नहीं लगना, very common. Abdominal cramps. Before even starting the periods, you're having abdominal cramps. Now, this is really, really a point of concern. Then, joint and muscle pains, muscle aches, especially in the foot, in the feet region, in the leg, you are having muscle cramps. Then, weight gain. Some females gain weight on a temporary basis. Then, very common issue, acne. A lot of breakouts happen on the skin, on the face. These are due to the hormonal fluctuations. Digestive issues. A lot of female face constipation, diarrhea, even acidity, gas. A lot of such thing happens as your PMS symptoms. Now, talking about your emotional symptoms, behavioral symptoms, mood swings. कभी गुस्सा आ जाता है, कभी फ्रस्ट्रेशन हो जाता है बच्चों पे, ऑफिस पे, हस्बैंड पे. बहुत कॉमन मूड स्विंग्स होना. एंग्जाइटी, डिप्रेशन, रोने का मन करता है, नींद नहीं आती है, रात भर यहाँ से वहाँ करवट बदल रहे होते हैं. कंसंट्रेट, we are not able to concentrate during those days. A lot of appetite changes, a lot of cravings happen. You want to eat something which is much more of sugar, salt, and everything. Then overeating. For some people, there is a lots and lots of overeating. So, what to do for this? So first, let's understand the root cause of the PMS. Why does the PMS even happen? So PMS is basically related to your estrogen dominance, your hormonal fluctuations. So estrogen and progesterone, these are the two main hormones which are related to feminine issues. When there is more of estrogen and less of progesterone, then all these things happen, which is known as estrogen dominance. Your mood swings, your irritability is related to your estrogen dominance because estrogen works as a stimulant for the brain and increases the production of neurotransmitters like serotonin. Now, this is responsible for your anxiety, your depression, your irritability. Estrogen dominance is also related to your breast tenderness, your bloating and water retention. Now, when there is estrogen dominance, it will lead to water retention. Will lead to your sodium retention, which will increase your swelling in the abdomen region. Weight gain. So, high levels of estrogen can also contribute to your weight gain, particularly in the hip region, thighs region, abdomen region. So, due to this, you temporarily your weight increases. Headaches and migraines, as I have told you, is also related to your estrogen dominance. Then imbalance in the estrogen and progesterone can disrupt your sleep, reduce energy levels. So that is the reason why you get remain fatigued the whole day. Now the diet plays a major role in a lot of hormonal fluctuations. If you are a person who is consuming a lot of caffeine, a lot of processed foods, a lot of street side food, a lot of dehydrated foods, a food which is ready to eat, spicy food, then let me tell you, it will increase your gut inflammation because it causes a lot of gut dysbiosis, increasing the harmful bacteria in the gut, which increases the inflammation, causing a lot of fungal infections to increase and leading to a lot of hormonal fluctuations. Then when there is a gut dysbiosis, this means whatever food you are eating, it is not getting properly digested, so the nutrition absorption from the gut is not happening properly, leading to a lot of nutritional insufficiencies like zinc, magnesium, a lot of vitamin B complexes, calcium, etc. It is not getting properly absorbed. So these nutritional insufficiencies, gut dysbiosis, gut inflammation, gut infection will also lead to a lot of hormonal fluctuations, which is responsible for your PMS symptoms. If you are under a lot of chronic stress, maybe anxiety, maybe depression, maybe workload, maybe relationship issues, or if your sleep is deprived, then it will increase your cortisol levels. So the cortisol levels, these are the hormones which are responsible for anti-stress. But when the you are under chronic stress and the cortisol level increases, it gets dysregulated. That means your body is in a flight and fright mode. Your hormones will go haywire. Your neurotransmitter balance will be all gone, leading to your PMS symptoms. Hypothyroidism is also related to worsening or exacerbation of the PMS symptoms. So if you are the one who is having high TSH level, you are having hypothyroidism issue, please consult your local doctor and get it regulated. Now, as I have told you about gut dysbiosis, that means much more of harmful bacteria in the gut. When this happens, then your estrobolome is compromised. So what is estrobolome? Estrobolome are basically a special group of bacteria in your gut which are involved in estrogen metabolism. So when you lack estrobolome in the gut, that means will be an estrogen dominance, leading to your PMS symptoms to get even more worse. Then gut inflammations leading to leaky gut. So leaky gut, a condition where the intestinal permeability is compromised and a lot of toxins, food particles enter into the bloodstream. This will trigger the systemic inflammation, causing hormonal imbalances and your PMS symptoms. Now, it was all about the various root causes responsible for your PMS symptoms or PMS symptoms to get worse. Now, how do we manage it? So, number one, increase your fiber intake in the food because that will help you to eliminate the estrogen levels, that will help to increase the estrobolome in your gut. Reduce the intake of processed foods, outside food, high sugar intake, high salt intake. Include a lot of cruciferous vegetables like broccoli, cauliflower, kale. That will increase your estrogen metabolism. Then balanced diet. Carbohydrate, fats, protein should be in a balanced way in your plate. If you have a PMS symptoms which is much more worsened, that is affecting your quality of life, I think you should avoid the dairy products. I have seen many of my patients who have avoided dairy products and have seen a lot of improvement in their PMS symptoms. Then include anti-inflammatory diet, that is avoid consumption of wheat or actually reduce it. Take more of the jowar or ragi roti in your diet. Then avoid the intake of white rice rather than switch on to millets, foxtail, barnyard, kodo, little millet. Any of them, maybe red rice, maybe brown rice, as they are more rich in fiber and a good source, a positive source of carbohydrates. Then please include a lot of healthy fats in your diet. People have a lot of myth regarding the fats, that they are not good for the health, they will increase your cholesterol level, but that is just a myth. I will come up with another episode on benefits of having good fats in your diet. Now, healthy fats means omega-3 rich foods. Now, these can be organic fishes, flax seeds, coconut oil, A2 Bellona ghee, chia seeds, flax seeds, and all. Vitamin D, very, very important for your hormone balancing, and calcium to get absorbed from the intestine. I have made a short on this, so you can refer to that thing, why calcium and vitamin D are interlinked to each other. Then sunlight is the only natural source of vitamin D, so please make sure that you are getting exposed to sunlight daily, any time of the day that is convenient for you. Sunlight is always and always good for the health. Then include magnesium rich foods, or you can take magnesium supplements there, because that will give relaxation to your muscles. Now, talking about the lifestyle changes, as I have mentioned earlier also in my previous episodes, that sedentary life brings a lot of hormonal imbalances. So please include daily dose of physical activity in your daily routine. These can be swimming, these can be dancing, these can be maybe yoga, or maybe some gymming, or whatever you like is. Please include physical activity daily routine. If you're able to manage your stress, then it will also be very good for managing your hormone imbalances. So journal writing, meditation, talking to somebody, some friend, or just physical exercises and all are a very good way to manage your stress levels. Supplements, some supplements are very good in maintaining your hormonal imbalances and to treat your root cause of the PMS symptoms. You can contact any of the integrative doctors, the functional medicine expert, and get yourself tested and take a customized plan where your body will be healed and cured from inside rather than just a symptomatic relief. Include calcium and vitamin D, DIM supplements for your estrogen and progesterone balance. Magnesium and zinc supplements will provide you with the relaxations as they are the vasodilators. Omega 3 are anti-inflammatory, multi-mineral and multivitamin supplements for the proper nutritional uptake. Then probiotics, postbiotics, prebiotics, very important for managing your gut health. Apart from that, there are many of the herbs like chia seeds, flax seeds, walnuts, almonds, then your pumpkin seeds, fennel seeds. A lot of things is there which will help you to manage your gut health, which will help you to manage your PMS symptoms, hormonal balancing. So this was all about your PMS problem. Hope it helps you. If you have any questions, any feedbacks, you can get in touch with us, and please subscribe to this channel for much more update on womanhood. Then please share with any of your friend who is dealing with the problem of PMS and don't know what to do. See you again with another episode of Tea Time and Gossip with me, Dr. Aparna. Till then, signing off. Thank you.